Hello, I'm Dr. Michael Kotze, and I'm an orthopedic surgeon here at Evergreen Hospital in Kirkland, Washington. And I'm going to be talking to you about tennis elbow. Tennis elbow is a common term that is used to describe pain on the outside of the elbow from a tendon injury on the elbow here. So if you look on the outside of your elbow, there's a bony prominence that you can feel with your fingers. It's right underneath the skin there. And there are tendons that attach to this prominence here. And these tendons turn into muscles over here in your forearm. And then those muscles eventually connect to a few tendons that go down to your wrist. So when you use your hand to grip something, or you bring your wrist back or forward, these tendons move and the force is transmitted down here all the way through these muscles here, all the way to this spot right here where these tendons attach onto this piece of the bone. Now, if you have an injury to these tendons where you overuse it or you really stress that tendon there, you can have damage to the little tendon fibers here, and that damage usually heals. But when you combine that with overuse of the tendon, that tendon doesn't heal, and you get permanent damage to that tendon here, and that turns into pain on the outside of your elbow every time you try and use your hand to grip something, twist something heavy like a jar, or even use a keyboard for a computer. And in cases when that pain is really bad, that pain can become constant and is there even when you don't use your hand. And it can even wake you up at night if it's really severe. So the diagnosis is made by your doctor, and your doctor is going to take a careful history, and you're going to tell him that most of your pain is right here on the outside of your elbow, not anywhere else, and it's made worse when you're using your hand or gripping something. Your doctor will find out which spots on your elbow really hurt, will put you through specific maneuvers, and when those are done and the doctor is pretty convinced that this is a classic tennis elbow, he or she may get an x-ray just to make sure there's no other reason that you have pain in your elbow. Most of the time, there's no changes on your x-ray when you have tennis elbow. And if your doctor wants to be even more sure that the diagnosis is tennis elbow, he can put some numbing medicine around this tendon here with an injection, and if your pain goes away, then he would be pretty convinced that this is a tennis elbow. Now, once you make that diagnosis, then you can give some treatment. And the first treatment option for this is stretches. And these are stretches that you can do at home, and the stretches are meant to stretch this tendon out because sometimes the muscles here can become very tight, and if you stretch these muscles out, take some stress off of these muscles, it'll take stress off of the tendon that it's attached to and give it a chance to heal. Another thing that can be used is a brace, and a counterforce brace is a special brace that goes right here on the outside of your forearm, and that brace is meant to take stress off of these tendons here and put it right here instead. So it moves the stress point of the muscle here when you're using this tendon over here. And what that does is if you take stress and put it here and you take it away from this area, then this area has a chance to heal. Another thing that can be done to help with the pain is a steroid injection. Now, a steroid injection can help decrease inflammation around that tendon there and allow this area to heal. And sometimes patients need formal therapy to teach them the stretches and the strengthening and all the exercises that should be done. And usually when you combine all three of these things here, or four of these things here, 80% of patients get excellent pain relief. But in 20% of those patients, they need to think about another treatment option, namely surgery. So in surgery, this can be done arthroscopically, and the surgery is meant to, or the goal of surgery is meant to remove the damaged tissue. So we make a small little incision on one side here, make another small incision on the other side of the elbow. We put in a camera that goes through there. This is my basic picture of a camera here. This is about 4 millimeters wide, so it's a very small camera. We can look on the inside of this tendon here, and then we can use a very small little instrument here and clean up all the damaged tissue. And we basically take out all this damaged tissue in here, and usually what is left is a small little defect right in here, and this area here will fill in with new healed tissue here, and that new tissue will not be painful, and that has an 80% success rate. So 80% of patients who go on to surgery get some form of pain relief. Many people get complete pain relief, but most people say that their pain goes down from an 8 out of 10 to, let's say, a 2 out of 10. So it still might bother them with some very strenuous type of activity, but the worst of the pain is usually gone. There are risks, however, with surgery. Again, the biggest risk is that it may not take away the pain, but other risks are very rare, such as infection or elbow stiffness or nerve injury. And while they are rare, these things do still have to be considered. And so generally I recommend surgery as a last resort when all the other treatment options have not worked and you've given it at least a few months for this to heal on its own without surgery.